mentioned, we're going to describe here how a virus, which symbolizes an innovation, in this case the virus is HIV, comes into a much more complex system that has evolved to keep itself the same, to maintain the status quo, and start to change that system and become part of the DNA. So how does it do that? Well, let's go with the first step. So cells, when they are communicating with their environment, they have things on their surface that are called receptors. And these actually transit the boundary and help the cell read and understand things that are going on outside. These have a pre-existing function completely independent from what the virus does. But the virus has evolved to take advantage of these boundary-spanning receptors. So HIV's first step is to bind to a pre-existing receptor that transits the boundary of the cell. Then it binds to another one. And when it does that, the virus is able to fuse with the surface of the cell and introduce its component parts. So it has viral proteins, it has viral materials. These come into the cell because it bound to a pre-existing receptor. So that's step one of our learning from HIV in bringing innovations into an existing system. Once it has done that, as I mentioned, it introduces its viral material. This viral material is RNA. Now, as I said in the first video, inside of human cells we have DNA. The human cells don't like RNA for the purposes of understanding the message. HIV has evolved to recognize that. So it changes its RNA into DNA, and it uses its own viral proteins to make that happen. So it's making its message accessible to the larger system that it's changing. So that's part of step two, make the message accessible. Another thing that happens as HIV changes its RNA into DNA is that it introduces lots of little changes into the DNA itself. These are mutations, and this makes HIV incredibly adaptable. This is part of the reason why HIV is so good at spreading, and it's so hard for us to stop it. Our lesson for this is that the message of the innovation needs to be adaptable. So let me just pause here for a second and say, what can we learn from this? This is all very interesting, but what can we learn when we're thinking about introducing innovations into human systems? So let's take one specific example. Let's imagine now that this complex system into which we're introducing something new is a hospital. And this is a real-world example. Hospitals have to deal, obviously, with all different kinds of challenges, but one specific challenge that we've studied in our team is that patients with a certain kind of heart attack who come to the door of the hospital and they need a certain kind of treatment within 90 minutes. So the idea is that these patients arrive at the door of the hospital, they need a treatment that's called a balloon within 90 minutes. It used to be that many hospitals in the United States were having door-to-balloon times that were much longer than 90 minutes. Once that change is introduced and the patients get treatment faster, they have a much better health outcomes and much greater likelihood of success, and sometimes it makes a difference for survival. So the innovation in this case would be introducing changes to the way the hospital functions so that door-to-balloon time is lowered to 90 minutes or less. So how was this innovation actually introduced? Well, first it was brought in by people who were already boundary spanners. So it may be a cardiologist who had read the papers in peer-reviewed literature about reducing door-to-balloon time. Sometimes it was a quality improvement officer whose job inside of the hospital is to bring in new ideas to help improve processes. But always, the innovation came in on a pre-existing boundary spanner. And then the next piece is to make the message accessible. So sticking with the door-to-balloon time example, the steps of reducing time from door to balloon were originally, as I mentioned, published in academic medical journals. But those steps needed to be accessible and understandable to the people inside of the hospital who are actually doing patient care. So that's making the message accessible, making it understandable to the people who are going to be using it. And also, the innovators for door-to-balloon time found that they also had to be flexible. They had to say, okay, here are the steps that you can follow to reduce door-to-balloon time, and sometimes people would say, well, we can't do step 3 quite like that. Okay, then let's change it. You're going to keep some of the core message the same, but you're going to be flexible and adaptable so that this process will proceed. So from this biological model of spread, something that's evolved to be very good at spreading, we can take these 2 lessons about how to introduce an innovation, a health innovation, into a complex human system. Now, this is not the completion of the life cycle. I keep kind of talking about getting into the DNA, and that's really where HIV is going. So in the next video, I'll take you through the steps, we'll put them here, about how HIV actually gets into the DNA of a cell, and that's really the goal. That's the implementation of this change to make it a permanent part of the system.